Hi, I'm Tyson Franklin, and welcome back to Podiatry Marketing. With me is my co-host, Big Jim McDannald. How are you doing today, Jim?
Tyson, I'm doing well here in beautiful Montreal, snowy Quebec. I hear the jingle bells jingling. It's that time of year.
I love this time of year. It is. I'm a big Christmas fan. I get into the whole spirit of it. I love putting the tree up, and we have a train that goes around our tree that actually makes noise and has smoke, that puffs smoke. And I think even when we have no kids in the house, I will still set the train up because I just love that Christmas spirit. And I've had some people recently that I've bumped into who love that I call you Big Jim Mac.
Well, I'm happy to hear that. Definitely not a nickname I've ever had. Obviously, you've never seen me in real life, so I guess the listeners will have to guess at some point maybe my height, my weight. If they've seen the videos, right? They probably know that I'm a large man who works out on the daily. But I appreciate the nickname. It's very fitting, I think.
Well, you sound tall. I went to this podcast conference once, and this guy that I'd known for a number of years on podcasting, bumped into him in real life. He's like 6'10". And I went, my God. I said, you look so much shorter on a podcast because he's sitting down. And then I've had other people that I've met who I've had them on the podcast or seen them on video, and they're thick set, some of them big mustaches and all that. Yeah. And you bump in there and they look like they're 5'2".
Yeah.
And that's a lot harder to say, oh, you seem much taller on video.
Yeah, it's not the same.
You and I,
we're
just average. Sure. We're just average. So, Jim, what are we talking about today other than our height?
Yeah, besides the height, weight, and Christmas season, we're talking about being deliberate about attracting right fit patients. Like, how do you go about doing that? We're going to get into that today.
And what do you mean by being deliberate?
I think, when we're starting off in practice, we're kind of happy for anyone to show up at our door. We want to, we don't necessarily have a clear vision of what we want our practice to be yet. And we're just looking for ways to pay our staff, pay our rent, or pay for our building, pay back our student loans. Not that we're I wouldn't use the word desperate, but we're kind of open to whoever's willing to come and see us because we've been training for so long. And now is the time to kind of recouping all that time, effort, delayed gratification with kind of building the practice and kind of getting some revenue in the door. So I think that's kind of where people start. And what happens, like I said, is, there's not always a clear vision of the direction you want to take your practice. So you can kind of by default, you kind of become a jack of all trades within the profession or within the specialty, and not necessarily walking down kind of your ideal practice path.
Yeah, and I don't think there's anything wrong when you're first opening up your business, seeing everybody, because sometimes you may think, oh, this is the type of patient I really like. This is what I love about podiatry. But once you start being open to all parts of podiatry, because even at university, you may not be as exposed to certain areas as much as what you would have liked, you might find all of a sudden warts is your thing.
No, I think that's a good point. And, for example, I got into podiatry initially because I was a runner. I'd had lower leg injuries, some foot problems, kind of got into some orthotics, which really helped me. But then I know it was during school or during residency, you're based out of a hospital, you're taking call, you're seeing patients in the hospital, you're doing surgeries a lot. And I wouldn't say I was necessarily seduced by surgery, but I felt like, well, now I'm like the surgeon. And while you can still do surgery on runners, like I maybe moved away a little bit further away from kind of initially what interested me in the practice to get into practice. And kind of as I got back into practice, I enjoyed doing surgery and doing things like that, but I wanted to kind of move towards that sports medicine or that running medicine, and kind of where I set myself up in practice, it made it a little bit difficult of a transition. But I think it's just knowing yourself. And then, kind of like you said, you don't have to know right off the bat. But probably the turning point for a lot of podiatrists is that their schedule is full, and maybe they're seeing either patients that are coming with diagnosis either that they aren't that excited about, or really aren't getting the level of reimbursement that makes it worthwhile to have those types of patients or those type of diagnoses within their practice.
Yeah, because I think there's a couple of, like you said, there's a path that you're going to go through, and I think you must think about what steps you're going to take. because I know when you set your clinic up, at some point you will start to get to capacity where it starts to fill up. And I know a lot of podiatrists straight away go, oh, I need to employ another podiatrist. And I'm like, no, stop. Do you need to employ another podiatrist, or do you need to just change the path and direction of your clinic a little bit and start saying, well, I enjoy these things, these 9 out of 10 things. So I'm just going to make sure I'm doing that. And that other 1 out of 10, we're not going to do that anymore. And that may free up some capacity. And I think that's a step you should take before you start diving in straight away. Oh, I'm going to get another podiatrist.
No, I think that's the deliberate, stepping back and looking at the situation. Like you said, once you're kind of nearing capacity or getting close to capacity, you kind of really need to break it down to basically two things. Like, what do you want more of? And then what do you want less of? And like saying that out loud seems like, oh, I wish
That's
life
obvious.
was that. Yeah, like I wish life was that simple, Jim. I'll just like, yeah, of course. Like I'll just get more of what I want and cut out less of what I don't want.
I want more abs and less fat.
But
It's easier said than done.
No, for sure. I mean, yeah, you actually, one requires a lot more time and effort, and one just getting the fat on just requires probably more calorie intake. But besides that topic, but
it still applies though. If you think about that, what you just said, then it still applies. One, to get abs takes work.
Yeah.
To get fat doesn't take a lot of work. You still got to work on it, but it doesn't. It's not hard to do. And I think working at what you like doing more of and concentrating on that is like trying to create the abs. It's going to take work to do that. Whereas just seeing everybody, well, it's easy. You can just sit back and see anybody that comes into your clinic.
No, for sure. And I think you kind of have to like take an approach where it's kind of like, what is that next action that's going to lead you to one of the, to the kind of ideal result, not tomorrow, not the next week, but, months or years down the road. So you're kind of where you want to be at that point in time. So kind of like understanding, what are those, actions that you can take, whether it's just, initially when you want something, you can put it, it's important to know what you want internally, but then it's how do you kind of communicate that to external stakeholders, to patients, to other healthcare providers, to, if you want to treat like me, like I like to runners. So how do you let runners know that you're available and skilled to help them with their problems? So part of it is like taking that internal, what you want more of, and then kind of putting it into the external world. And that's kind of that first step of getting probably more of what you want.
A really good quote I saw was from this guy, Patrick McFadden, who's a marketing dude. And he was on my old podcast. And he said, all marketing does is give you more of what you've already got. So if you want to change the type of patient you see, then you need to change your marketing. So you need to change the message you're putting in there. So like you said, if you want more runners, you can't keep saying, hey, I'm a general podiatrist. There's something about running has got to be, you've got to change your marketing to start targeting the type of people you want more of.
No, I think that change is important, but I think it's also, I think people get a little bit afraid. Like you don't need to go from like 0 to 100, tomorrow, right? You don't have to make the change so rapid that it feels unsettling, not only for yourself, but for, those in your community or those you've been practicing with. Like we talked about previously, just because you eliminate maybe let's say a diabetic foot wound or ingrown toenail section from your website, doesn't mean that people won't necessarily call you up and say, hey, do you do these things? And maybe you still can do them and are willing to do them, but it's not the thing you're marketing or putting out there for public consumption. So I think that's an important component is you don't have to like, do it so, niche yourself so quickly or so dramatically that that you're cutting these people off. But at the same time, you do have to be deliberate if that's the path you want to move in. If you're happy just kind of sifting through general podiatry patients and trying to find another way to filter out what you want to see and not see. But you're going to save yourself and your staff a lot of time and effort on the front end by developing marketing, not only messages, but visualization, your branding, your logo, things that are in lockstep with that future goal or that path you want to walk down.
So when you were saying that some people have a fear that they're going to miss out on something or they've got to almost like rip the Band-Aid off. Okay, we're going to make this dramatic pivot. It's not making a dramatic pivot. It's just slightly changing the angle. And it's like when they say a plane only needs to change course 1 degree, that a couple of thousand miles later, it's in a completely different spot. So your business is pretty much the same. You only need to make a small change initially, and in the long term, that will start making a big change to your business.
No, for sure. And I think one example of that might be like maybe your website is there's certain aspects that look like a general podiatry web page, but you have very targeted pages on that website that maybe you do Google ads to or Facebook ads for. So you're doing a little bit something different on a different channel, pointing back to the website that you own that does have authentic photos that shows you the expert in this thing. But maybe you're just not pushing as hard. Maybe it's not totally eliminating those things from the website, but just not making them as visible, or maybe they're lower down on that list of things that you do. So there's different levels, like I said, of making that pivot or that transition. If you do live in a big area like Chicago or Los Angeles or Boston or a big city, you can get away with being much more niche than maybe you can in a smaller university town or a smaller town. But there are different ways to highlight those things that you want to do, like I said, by externalizing and communicating that skill set and those type of patients you want to see.
Do you think it's fear? Like we said before, it's fear that stops people making this change. They're so scared of, I've got my business going, I've got commitments, I've got bills. I'm too scared to sort of just either let something go. So give you an example. I was talking to someone just recently and I said, what's your ratio between biomechanical patients to routine care? And they said 80-20. I said, oh, that's right. 80% bio, 20% general, routine. They went, oh no, the other way around. 20% biomechanical, 80% routine. I went, okay. I said, so it's Monday. If I rang your clinic today no, it was Tuesday. I said, if I ring your clinic today, had a big weekend, I did some stuff, woke up Monday morning, my heel was just killing me. It was no better this morning. Somebody said, you should see a podiatrist. I rang you up today. When can I get an appointment? He said, looked at his doing, about 10 days. I went, not good enough for me. I said, so you've just done all this marketing, Google ads, done all this stuff to tell me that you're the person I should see and I can't get an appointment with you for 10 days. I said, all you're doing is advertising for the new guy that's set up down the road. He's got all these free appointments. I said, so you've got to, you have to start massaging your diary to be able to get me in. And I said to him then, how many, do you know, when you do your online bookings, how many of your online bookings are biomechanical compared to routine? He said, I don't know. I said, well, that's something else you got to look at because it could be the same thing. You've just got to massage the clinic so that you can fit in more of the things you're trying to build up.
No, that's a really good point. I think, I don't think it's necessarily, I'm not saying that like all podiatrists are afraid. I don't think that's the case. I think it becomes, when you're not deliberate about it and you're just kind of taking what comes your way, I think that's what a lot of people are dealing with is they haven't really stopped to think about what they really want and how they're going to kind of make that happen. It's like, it's kind of like the old way of marketing, right? Like put your head down, you work hard, those things are going to find their way to you. So I think that it kind of ties into like the unwillingness to market in a way. Like it's almost like a similar type of thought. It's like, I'm going to do these things and just see what kind of comes my way. And like we talked about with the marketing, with the website, I think also they just like, but most podiatrists know they need a website, but they don't know the difference. Most podiatrists don't know there's been kind of a website that's kind of like a placeholder. There's some kind of generic information that lives there that has their phone number, kind of a form that people will call and try to make an appointment versus like a website that's like actively marketing what they want to do, that builds trust, that shows them as by far a leading expert in the local area for the type of care that they want to do. And once they see that, that's kind of like that, stock images versus you with a photo treating the patient you want to treat. Until you see that, like that difference in a website or see that difference, the value or the kind of like, it's hard to have that aha moment because people are so busy in practice. Like most of our listeners today, I'm like, they're seeing 30 patients a day, then doing paperwork after work or on the weekends. I don't think it's a matter of these decisions are made out of fear. It's just they're busy and they can't really fathom how some of these small changes or these deliberate actions to kind of building that ideal practice path, like it's like it just doesn't happen that way.
Yeah, well, I know when we were making like deliberate changes and instead of just letting everyone come in whenever they felt like it, we started saying on these particular days when we plan ahead, only this type of patient can come in, and this type patients can't. No matter
Yep.
what, they cannot fit in on these days. And everyone was a bit nervous when they first did it. And I've done this with clients as well. And as soon as they make the change, they go, my God, it filled up with the type of patients we wanted. And then slowly and surely, they just increase those times. So it's not as though they blocked out 3 days the following week. It was exactly this is what they're going to do. Started with half a day, and then half a day went to 3/4 of a day, went to a day, went to a day and a half. And they just, like you said, it's all about making deliberate actions, not just letting things happen.
No, I think that's a perfect segue into kind of the next segment, which is like knowing what you want less of. I mean, you obviously, when you went through that process, you knew what you wanted less of, right? Because you were willing to
Yeah.
sacrifice those days or those hours in order to set aside time for the things that you wanted to do. But until you know what you don't want to do, right? And everyone knows what those are in their own practice, but just take time to know what those are. And there's different kind of tactics or different ways to go about doing it. Like you said, setting those time blocking, like you did, is one opportunity. Maybe it's, some people will just go cold turkey, right? I don't want to do any routine care
Yeah.
anymore. I don't care.
And I've got people that I've helped do that, and they just said, yep. And they just ripped the Band-Aid off, said, not doing it anymore, drew a line in the sand and said, that's it. And it worked out for them. They said, my God, all of a sudden we just got full of all the type of work we wanted to do and no more routine care. And they were happy.
No, exactly. And there's different ways to approach that cold turkey. So it's not just like you wake up tomorrow and you just implement this, right? It could be maybe for the next 6 months or a year, you're going to kind of create like a financial stockpile or like a reserve just so you can weather any kind of storm that might happen, right? We've been through a pandemic in the past. We've been through different aspects of things where, if you want to make change or the change happens to us unexpectedly, maybe having a financial reserve so you can weather that storm where you're going to test it out for 3 months or 6 months to see if you can get away without doing the routine care. So there's different ways to kind of do this cold turkey. I'm not saying that people should be irresponsible or rash implementing something like this, but
nothing wrong with the irresponsibility every now and then.
Well, I just
It
feel
worked
like,
for me.
no, for sure. But I think that's another approach. I think one approach you brought up as well that I think it needs, like we talked about, keep saying the word deliberate, right? But if you're going to bring on, if you don't want to do the routine care, but there's still a pipeline of that and you can make some money along the way, and you feel like you're providing, I think some people also get into things like they want to provide specific types of services to patients in their local area, right? Maybe they're in a smaller place that doesn't have great care, or they're concerned about what's going to happen to those seniors if I just cut people off. So, one option would be to bring on an associate to take over some of that stuff. But like I said, it's not just something you want to fall into or like, oh, well, we have all these patients now, we should just bring on an associate. It should be much more planned out, much more deliberate, making sure you're finding the right person. There's a lot of steps that would go into hiring an associate. This is not that podcast where we're going to talk about that. I'm sure might be a great topic for another show in the future, and how to maybe market one of your associates. But I think that is an option that is a worthwhile thing to explore, but it should be something that's rushed into.
Well, I think right from the start, it's one of those questions where people tell me they're really busy and they want to make this change. I'll say, do you do home visits? Yes. I go, do you like them? No, don't do them. It's really, really simple. Call up somebody, another podiatrist close by, and say, can you do these home visits for me? I don't want to do them anymore. And get them doing it. Then look at the next type of patient that you don't enjoy or you just don't get any satisfaction out. It's not that you don't like the patients. Now, if they've been patients that have been really long-term for years and you have a really good relationship with them, you may want to just keep them, especially if when you see them, it makes you happy. But if they're just a face that drives you nuts when they come in, if you can move those patients to your competition down the road and you can keep them busy seeing the type of work that you don't want to see, that means the patients that you do want to see more of can't get into them, which means you've got more chance of actually seeing them as well.
No, I think that's a great point. Not only, kind of leverage the associate aspect of things, but, passing them along to the other practices in town, it definitely is a good option. One other way to kind of filter some of this care or some of these patients that you don't necessarily want to have in your practice is, looking at your insurance plans or the, HMOs or the local, different Medicare or Medicaid type programs, things you just don't want to see anymore. Maybe it's just taking up too much of your time. It's kind of, like I said, it's just filling in gaps in your schedule that you'd rather see other types of patients.
Yep.
Understanding which providers are not paying you kind of what you're worth, right? I think everyone that's listening to this podcast today knows certain insurance providers or carriers who just, they're a pain to deal with. They kind of send your claims back to you. They don't pay on your claims. They create almost more work for you and your staff to get paid than to actually receive the payment. You know who those folks are, and being deliberate and kind of gradually chipping away at who you have kind of on your insurance roster or on your payer roster is one way to approach this as well.
Yeah, and in Australia, that's for like EPC, bulk billing type patients. In the UK, it'd be probably a different group of people again, but it's in Australia, it's more of these like government patients that are referred to you, and some of them just expect to be bulk billed, and everything has gone up. To run a practice these days has gone up so much, yet the payments you get from some of these insurers are just not enough. And if you want to keep seeing them, that's fine. But if you want to make that change, that could be another good place to start.
I think your kind of time blocking things that made me think of this as well. I know that occasionally I would get a workman's compensation patient into my practice. And to be honest, it would have been helpful for me to have 1/2 day per month just dedicated to that type of patient. Because when it came to workman's compensation patients, and I definitely understand that people get injured on the job. This is no shade on them, but it would almost throw off my entire morning or my entire afternoon with the amount of paperwork I would have to fill out, my staff would have to fill out to really thoroughly understand the mechanism of injury and the type of documentation needed to make sure that all the checks, all the boxes were checked and the T's were crossed and the I's were dotted, because it would just be an enormous amount of time. But if I'd had that set away in a different time of day, or I just didn't, I chose not to do it. I enjoyed some of these patients, so it's not like I wanted to get rid of them, but it's like how you organize your practice and being deliberate about it can really not only reduce your stress, but make sure you're providing great care to these patients.
Have you got any other pointers on this one?
No, I think that was, we said the word deliberate about 3,000 times. So I hope that's hammered into.
I think that's a great word, deliberate. It's being really deliberate in your actions, I think is really important. I think it's a great word.
No, I think it's good too. I think it's just a matter
word
of
the year.
Well, that's a great way to end. We're getting close to the end of the year now, but I think it is just one of those things where it sounds simple. Know what you want to do more of, know what you want to do less of, and then kind of plot a course to make that happen. And I think not only will your patients benefit from this kind of narrow focus or being deliberate about things, but I think you'll also gain more professional satisfaction by knowing that you're actively pursuing what you want to do with your professional life. Can be extremely satisfying.
Yeah, I totally agree. So, Jim, I think we'll wrap it up there. I just want to wish everyone wish you a Merry Christmas first, Jim.
And happy holidays, Tyson.
Yeah, I know. Happy holidays. So in Australia, we have Christmas Day, and then we have Boxing Day follows it. So, and they're two public holidays. Well, of course, Christmas Day is a public holiday, and then Boxing Day is a public holiday. What about where you are? Do they have a Christmas Day, obviously? Do you have another day after that?
Yeah, so I've been in Canada for 11 years, and since we're part of the British Empire, we also have Boxing Day here in Canada.
Oh, right, okay.
So it's here in Canada, but it's in the U.S. I didn't grow up with it, but yeah, a little Boxing Day to celebrate the holidays with as well.
Yeah.
Yep, lumps of coal in the stocking. Yeah, we're going to reminisce about 2022 and plot a course for 2023. Man, I hope
it'll be a short show then, won't it?
Between now and then. Sounds great, Tyson. You too.
Okay.
Merry Christmas.